My name is Ariel Kramer, and I'm joining you today on behalf of the Digital Health Hub Foundation. Sorry, it's taking a second.
You look good in that one, Ariel.
There we go. Better than the Zoom. So the Digital Health Hub Foundation is the digital health accelerator at the Worldwide Center of Healthcare Innovation. And our largest program is our award program, which seeks to find the next best, most impactful, and disruptive in 13 different categories. This year, we had over 1,500 companies apply and 350 were named quarterfinalists. And now we are down to our 124 finalists. I would like to introduce you to Matthew Holt, the executive producer at the Digital Health Hub Foundation and the founder of Healthcare Blog and Health 2.0 Conference. Matthew.
Thanks so much, Ariel. All right, brilliant. This is the last of, I believe, 15, or might be 17 or 13, a lot of categories for the Digital Health Awards. And this is the last and definitely not least women's health, although as I'm sure Brittany and others will tell you, it's probably had less attention than it should have had over the years in digital health, especially given that I believe half the people on the planet are women, possibly, roughly. Anyway, so here's what we're going to do. We're going to start with the 8 rising stars, and they will all introduce themselves very briefly. They'll get like a 30 to 45-second elevator pitch from each one of them, and then I will introduce our category champion, a real expert in this area, is Brittany Barreto, who is the queen of femtech, and she will be running sort of Q&A after that. Then we will stop, and at about halfway through the program, roughly about 25 odd minutes, we will bring our 4 best in class. The rising stars are the obviously earlier stage companies. The best in class are the ones a little further along, been around a bit more, raised a bit more money. And we will hopefully by the end of it, those of you who are judging or watching will be able to have a good idea about who you're going to vote for to win the award, which is happening in 9 days time, 11 days time, so soon, Monday after week after next. Right. So with that, we're going to get going. But before we start, we have our friends at McKinsey. And I believe, Alex, we have you to give us a quick knowledge share. McKinsey is the knowledge partner of the Digital Health Awards this year.
Great. Thank you so much, Matthew, for having us. Just really excited to be here and learn from you all. I think just a really quick introduction. You may know us as strategy consultants that serve all sorts of industries, but have a really significant health, social, and public sector practice. But 2 things that you may not be aware of that I'll just share quickly. One is that we actually do partner with startups a lot, and we help scale and have worked with thousands across the globe and across healthcare services, all sorts of industries. And then second, we don't just partner with earlier stage companies on strategy. We actually do also partner for, for 2 to 3 years on launch and execution, and jointly kind of targeting and achieving revenue and margin milestones. So just excited to be here today and grateful for all of your passion and dedication to improve women's health. Personally, I'm an associate partner in our Chicago office, and I serve healthcare, payers, providers, and states on primarily value-based care and Medicaid. And so obviously, especially in the Medicaid segment, really large focus on women's health, including maternal and child health. So thank you for having me. I'll turn it back to you, Matthew, I think, right?
Thanks, Alex.
Yeah.
Great stuff. All right. So now we're going to dive right in. You can stop screen sharing, please, there, Ariel. We're going to go round the horn. I'm going to shout out a company name. The company representative is going to say who they are. Tell me the company's name again. Always good to repeat that. And in 30 to 45 seconds, explain what you do and what the product is and what the experience of your users are. And we're going to start with Hey Jane.
Hi, everyone. I'm Rebecca Davis. I'm the head of brand marketing at Hey Jane. We are a virtual reproductive and sexual health clinic that always puts patients first. From day one, we were founded and launched in 2021. We've been committed to providing safe, discreet medication abortion treatment, no in-person clinic visit necessary. And we've helped at this point more than 30,000 people get the care that they need. Today, we offer a range of reproductive and sexual healthcare services from the comfort and convenience of your phone. Our in-house clinical care team, which is composed of incredible board-certified doctors, advanced practice clinicians, nurses, and patient care advocates are always just a text away. And we're really committed to helping our patients get the care that they know that they need, because we believe the best person to make decisions about your body is you. Thank you all so much for including us.
Fantastic, and a very needed area given the let's not do the political commentary, but you know where I go if I was going to do it. All right, next up is Swing.
Hello, I'm Diane Shumay. I'm head of psychology for Swing Therapeutics. Through our digital therapeutics stanza and our Swing Care virtual clinic, we are providing fibromyalgia care that doesn't exist in the United States for more than 5% of folks and women diagnosed with fibromyalgia. Fibromyalgia is a debilitating condition with many, many symptoms, including debilitating chronic pain. And we provide an evidence-based approach with type 1A evidence for behavioral therapy through our Stanza digital health app, and our comprehensive and patient-centered warm virtual clinic with specialty trained physicians and nurses with coaching opportunities for our patients.
Fantastic. And always that's one of those diseases that has not had the recognition, attention that's deserved over the years. So fantastic. All right, brilliant. Next up is MICA AI Medical.
Hi, nice to meet you all. I'm Lilia Shwartsman. I'm co-founder and director at MICA. Analyzing mammography images correctly is the most crucial moment in early detection of the breast cancer. The physician responsible for that is the radiologist, who has to read over 800 images per day, relying only on the technology of the naked eye. And radiologists are overwhelmed, overworked, and because of that at risk of oversight. So we assist radiologists so they could save more lives. MICA AI provides clear tissue mammogram for women with dense breast tissue. Not many people are aware that 40% of all women have dense breast tissue. For them, mammography testing is unsafe because reading their images is like driving in extremely heavy fog. So MICA is a game changer at the breast radiologist arena, the only AI platform that cleans the density from the mammogram images, provide radiologists with clear mammogram image, and shows hidden findings that cannot be seen with the naked eye. We detect and classify the suspicious findings and provide a risk score for each one of them. And as a result, we reduce unnecessary, dangerous, and expensive tests and procedures, help the hospitals and insurers save money. We provide doctors with more confidence to make the right decisions and relieves patients of unnecessary anxiety.
Brilliant stuff. Great explanation. Thanks so much. Next up is Elizabeth Ruzzo at adyn.
Good. Okay. Hi, everyone. I'm Elizabeth Ruzzo. I'm the founder and CEO of adyn. adyn is a precision medicine company. Our flagship product, the birth control test, is the first and only test designed to prevent birth control side effects. We analyze a patient's medical history, hormone levels, and genetic data to create personalized recommendations that meet each individual's biology, medical needs, and personal reproductive health goals. We also offer a 25-minute virtual care visit with a licensed medical provider who's trained in delivering culturally competent contraceptive counseling that leverages the results of the birth control test. And we can also then ship the birth control prescription directly to a patient's door in under 48 hours. And more broadly, our mission is to make scientific discovery more inclusive.
Fantastic. Very well needed. Next up is Midi Health.
Hi, I'm Joanna Strober, the CEO and founder of Midi Health. We are a clinic for women between the ages of 35 and 65 to deal with all the symptoms of perimenopause and menopause. So we spent 2 years developing care pathways to deal with all of the stuff that happened to women during this age category, ranging from sleep issues to painful sex issues to hormone imbalances and joint pain and all the other stuff. And we have trained an expert staff of clinicians who are able to take care of all these symptoms and it is all covered by insurance. So it is not a cash pay business. Instead, we're able to provide insurance covered care, which we're really proud of.
And Joanna, how do people interact? How do women interact with you?
It's all virtual. So we everything is virtual, and then we partner with providers, in-person providers around the country, so we can refer in person when appropriate. So we make sure that women get their mammograms and their colonoscopies and all the other in-person care that they need. But with us, it's all virtual. So all the visits are just online.
Fantastic. All right, next up, and rocking that Y chromosome is Ananth Ravi from MOLLI. Thanks for coming. Thanks for the solidarity here on this panel.
That's right. I appreciate it. Hi, I'm Ananth Ravi. I am the co-founder and CEO of MOLLI Surgical. We're a medtech company whose mission is about making precision surgery simpler. Our whole philosophy is that a patient's experience of treatment is just as important as the treatment itself. And so for the vast majority of patients with breast cancer, their story starts with them being implanted with a hooked wire that looks much like a fishing hook, and they're in hospital, and it's implanted in radiology. And the surgeon then goes and palpates that hook, and they often faint in their discomfort. And we were compelled to do something different. So our company has now helped elevate the care for 8,000 women across North America, where we implant this tiny marker the size of a sesame seed, and we use a wand and proprietary tablet to provide true 3D guidance so that the surgeon can find it with precision and confidence and remove it very quickly, offering amazing cosmetic results while also taking care of the cancer at the same time.
Very, very clever. All right, next up, it's fertility. Do we not have a fertility person on? I'm counting. We should have. No, we don't. We're missing one. Sorry, I was confused by. I can't count up to 8, which is a perennial problem when you're an old man like me. All right. So last and definitely not least is Pelvital, if I pronounce that correctly.
You have Pelvital. So thank you so much. I'm Lydia Zeller. I'm CEO of Pelvital. Our mission is to empower both women and clinicians with convenient, effective products backed by rigorous scientific evidence to improve pelvic floor health. Our first product is called Flight. Flight is a novel treatment for female urinary incontinence. Incontinence impacts 60% of adult women, so not a niche issue at all. Flight is an intravaginal wand. It's the first and only product to apply a treatment modality called mechanotherapy to the pelvic floor to treat urinary incontinence. We have been shown in clinical studies. What is exciting about us is we've been shown in 2 substantive clinical studies to deliver both continence rates and durability of treatment effect comparable to surgery in a fast, convenient, in-home treatment. So really changing the gold standard of conservative care for urinary incontinence and filling a significant gap in conservative care for women and clinicians who do not want to have surgery. We're really excited to be coming out in a couple of months with our connected version of Flight, which further connects woman with clinician, both brick and mortar and virtual.
Brilliant. Okay, so that's it. So 7 of our 8 people. We don't have fertility unless someone will show up later. With that, I'm going to hand over to Brittany. Before I do that, I gave her a pretty crappy introduction before, so let me bolster up. She is the Chief Innovation Officer and the founder of FemHealth Insights, which, among other, is a sort of market research organization, really cool database in all of women's health. And she's the host of the FemTech Focus podcast, which some of you, if you haven't been on it so far, you should be lobbying to get on that. And then finally, she's also one of the co-founders of Coyote Ventures, which is a FemTech focused early stage venture fund. And you do about 15 other things as well, Brittany, but fantastic. Take it away.
You and I, our hands are in everything. We need to learn about boundaries. But until then, I am so excited to be presenting an award to one of you later in Las Vegas. It's going to be awesome. But I would love our attendees to learn a little bit more about what you do, and not just necessarily the product, the business model, the customer base. But I think so often we are asked questions that are more, well, how is this not going to fail? Or, questions like that. And I want you to tell us some of the more impactful stories, things that keep you going, that should be keeping our audience excited and engaged in the women's health innovation sector. So my question for you all is, what is a success story of your product being used? Either a success story by a patient and how their life changed, or maybe a physician and how the way they treat or diagnose patients was radically changed by your product. Matt, should I just go through and name them and they answer?
Sure.
Okay. Lydia, kick off with you. I'm just going to go left to right.
Sounds great. I'm going to give two really quick stories because they kind of articulate two ends of the spectrum. So the first would be a flight user who at age 41 had her a sling surgery for incontinence that helped maintain her continence for several years, but then she became incontinent again. These surgeries don't last forever. So this time her father, who is an OB-GYN, recommended flight to her. After 6 weeks of flight, which is our standard treatment time, 5 minutes a day for 6 weeks, she was able to play pickleball with no leaks. So that's a fantastic story of a woman who avoided surgery. And then I'll give one that I just love because it shows the human side of it. And this is a woman who became desperate when her nephew, he'd always greet her by picking her up and giving her a big squeeze. And she leaked, and it was mortifying for her. She said the only thing that saved her, it was dark, and she had dark leggings on and nobody noticed. So she started using Flight, and the next time he picked her up and squeezed her in broad daylight, she was completely dry. So, you know, just a tiny story, right? You could think, okay, this is not significant, but it really shows, okay, avoiding surgery and massive changes in how comfortable a woman feels.
I love it. MOLLI, which is the company name.
And I also get called MOLLI often. Actually, I have two stories. One of them was when we first launched this was a surprise. We received a letter from one of our patients. She unfortunately had a wire and had a cancer, and it came back, and then she had a MOLLI instead, and she compared the two experiences. And she wrote our whole engineering team thanking us for inventing something that revolutionized her experience, because she'd have both. And that, in terms of, you know, what keeps us going and moving forward, that was incredibly profound and impactful. And the other one that just recently happened was there was a patient who was told she had to have a mastectomy. She had a couple lesions in her breast, and she had to have a mastectomy because they were spread apart and they didn't have a precise way of localizing these two lesions. And one of the surgeons that adopted MOLLI placed 2 markers and I said, nope, I can do it very easily, and spared her. And she was so very grateful to be able to maintain her cosmesis and retain her natural breast tissue. So those are profound, and those keep us going.
These are not minor, folks. These are not minor. You're making big change. Rebecca from Hey Jane.
We are fortunate to hear every single day from our patients about how the care that they receive from Hey Jane truly saved or changed their lives. I could go well past the minute that I've got to talk about all of these examples. These are people who are parents who are focused on raising the children that they have. These are people who are college students who have big dreams for their future, and this allows them to fulfill those dreams. These are people, excuse me, who live in rural areas, can't get a pizza delivered to them, but they can get this care delivered to their door without people in their small town finding out about the care that they're receiving. We have had startup CEOs who have been able to follow their dreams because they're able to get care with us. You know, I think more than anything, it's an important reminder that abortion is very common. 1 in 4 people with a uterus will have it, will have one in their lifetime, and it cuts across all demographics, and you know, all people seek out abortion care.
There's 8 uteri on the screen. There's 2 of us who've had it, right? Statistically speaking, this is a very current issue. Thank you so much, Rebecca. Joanna with Midi Health.
Yeah, so really every day what we hear is mostly that women have felt unheard. And so here's one story. My provider listened patiently as I talked through all my concerns. She was kind and compassionate and did not make me feel rushed. It was clear she really understood me and my treatment plan. I felt seen, heard, and validated. There was none of the careless disregard or gaslighting that had been present with my other doctors. But we get a lot of those, but my favorite one was the other day, a woman got on the screen. She was holding a dildo in one hand, and she started jumping up and down. And she said, I had sex. I haven't had sex in 2 years, and I liked it. And both she and the provider started to cry. And I'm sharing that story with her permission. But it's incredibly rewarding when women end up getting the care that they need.
God, I love this industry. I just love what comes out of our mouths sometimes. But this is real life healthcare. This is what we need to talk about. Lilia with MICA.
Okay, we have many, but one to choose. There were a mammography examination, which was performed for women with dense breast tissue. And the MICA AI system indicated a malignant finding requiring a biopsy. The radiologist also suspected that it was malignant, but the surprise was that the biopsy results came back negative. Nevertheless, because of our prediction that the lesion should be with high score for malignant, radiologists decided to take one more biopsy, but this time using MRI, and it revealed as a carcinoma. The initial biopsy didn't yield accurate results, likely due to the density of the breast tissue, or maybe it wasn't taken in the right way. So these timely interventions spared the woman from a potential advanced condition that could have progressed over the next few months, demonstrating the performance of early detection facilitating by our system. And if they didn't have a MICA AI platform, probably they just will say for her to come after a year or even more, and the results could be very, very worse.
Wow. I love the mixture of you are saving lives and you are also allowing lives to be lived worth living, right? I love that, the mixture here. Elizabeth with adyn.
So birth control side effects are really variable. They range from, annoyances like acne and weight gain to life-threatening side effects like depression and anxiety. And we've been able to help people all along that spectrum. The metric I'm probably most proud of is that we have identified genetic risk for blood clot in 7.5% of our initial population, half of whom were actively taking a birth control that put them at a 30-fold risk of experiencing a blood clot. And so one of the populations that has been kind of the largest advocates of what we're doing is actually parents of teens. So 7 in 10 teens take birth control to manage symptoms of PMS. And so these parents immediately understand, why would I put my child through, a process of trial and error, especially when that trial and error might result in a life-threatening blood clot. So they have been a really powerful group. And on the other end, the more daily annoyances side, a recent story we had was an individual who had been on Accutane multiple times, which is a drug used to treat severe acne, and it wasn't working. And when she took Adyn's birth control test, she found out she had elevated levels of androgens, and that in fact, her IUD then might have been exacerbating her acne. And so she just felt like a huge amount of relief and surprised that her birth control hadn't even been part of the discussion in her acne care journey.
Wow. Wow. Connecting the dots, Elizabeth. I love it. And last but not least, Diana with Swing.
So fibromyalgia is a condition that is clinically diagnosed. That means that it's the self-report of the woman sitting in the doctor's office that results in the diagnosis. That means that symptoms like chronic pain, fatigue, brain fog, sleeplessness or non-restful sleep, these are things that a woman has to speak up about and advocate for, and a doctor has to listen to. Well, the common experience of our patients is that they've gone from doctor to doctor to doctor, that they don't really have a medical home, they're not really listened to. And we know that women with chronic pain at the same level as men with chronic pain are not treated the same. And so what we hear over and over again is patients telling us, you believe us, you listen to us, you provide us with care. In terms of our Stanza digital health, we have FDA clearance for that app. We've had a pivotal study showing that it improves across the whole constellation of fibromyalgia symptoms and increases quality of life. One patient, Maria, who used Stanza, went from being bedbound with debilitating symptoms to being able to go back to work and really embrace her life. And that's really what we're about at Swing Care and Swing Therapeutics, is about bringing women back to their lives and allowing them to engage back in all the things that they want to do as a person.
Absolutely incredible. Once again, providing them a life worth living. I've been giving permission to do a round, quick fire second question, quick 15-second answers. I wish that just women's pain or women feeling better was enough to move the needle. At our organization, we're very bullish on looking at the economics and the burden and the market values of it. And so I would love really briefly for us to go through and give us a statistic of potentially the economic burden of the disease that you're working on, or what is the productivity loss for an employer with an employee with this condition, or maybe there's some other thing that, you know, people don't necessarily associate with leaky bladder or breast cancer that is affecting all of us, because women's health is everyone's health. So Lydia, can you kick us off? 15 seconds. Give us a shocking fact as to why we should care about this that's outside of just women deserving better health care. You're muted, my dear. You got it.
My apologies. Real quick, 70% of the cost of incontinence is currently borne by women. That's completely unacceptable for something that impacts 60% of women. So the focus that we're taking is reimbursable medical device. But apart from that, 65% of women are going to avoid sexual activity because of incontinence, linked to more than double the rate of severe depression. 1 out of 2 falls are actually associated with incontinence, more than double the rate of UTIs. So, you know, a lot of concomitant related issues that are costly for women and payer.
The I've fallen and I can't get up commercial needs to be updated, apparently. Ananth from MOLLI.
Yeah, I mean, there's 2 million patients diagnosed with breast cancers globally every year, and 70% of them are eligible for breast cancer, and the vast majority of these women are getting wire procedures. So there's significant need to elevate their care. And another piece to this is by decoupling the wire from the surgical date, health institutions can be more efficient. We've seen an improvement of around 40% in radiology in their ability to see more patients by decoupling from surgery. And surgeons can start cases first case of the day and even do up to 40% more cases. So, you know, it's not only economically makes sense, but the global impact could be quite profound.
Okay. Rebecca from Hey Jane.
Yeah, the impact of abortion on broader health and well-being was studied in the Turnaway study, and a statistic that has really stuck with me was that they found that being denied a wanted abortion has serious consequences, including in the future 3 times more likely to be unemployed and 4 times more likely to have a household income below the federal poverty level. So not only does access to abortion impact health, but also being denied access has serious consequences for health and well-being.
I knew you'd have these stats, y'all, because women's health is way bigger than just women's health. Lilia with MICA.
Okay, 250 million mammograms are performed annually worldwide, and the numbers are increasing. Approximately 99% of these mammograms analyzed manually. Considering the severe shortage of radiologists, the world lacks is 42,000 radiologists, which are missing. And the fact that they have only 10 minutes per patient and are intolerable situation. With the MICA's platform, we decrease unnecessary painful biopsies for women by 40% and decrease the efficiency of the mammogram diagnosis and results by 24%. And this is a huge mean in the meaning of the millions of dollars to save for the healthcare system and insurers, and also many, many thousands of dollars and quality of life for women.
Joanna from Midi Health. You're muted.
Unmute, Joanna. Unmute.
I'm sorry. First, I just want to say the world desperately needs all of these companies. I'm just thinking about all the women that I know who need each one of the companies you guys are talking about. So it's actually very heartwarming to hear. 99% of women suffer from menopause issues. 50% of women said they won't apply for a promotion because of it. 25% think about turning down a raise because of it. And 10% of women actually quit their jobs because of their menopause solution. So in order for women to thrive in the workforce and to thrive, period, we need to have better perimenopause and menopause care. And that's what we're trying to do.
Amazing. Elizabeth with adyn. How is birth control affecting things outside of just picking your birth control?
There are many ways. So there are 74 million women in the US of reproductive age, and on average, they use birth control for 30 years. So it's the only drug someone most likely takes for 30 years of their life. And thinking about the economic impacts, nearly half of all pregnancies in the US are unintended. There's huge economic impacts. So it's $5.5 billion in annual costs in the US alone. And the number one reason globally that people used to not use birth control was lack of access to highly effective contraception. Today, the UN put out a report that it is now fear of birth control side effects, the vast majority of which are myths, and the other percent of which adyn can help with.
Amazing. And Diane from Swing.
So fibromyalgia affects 2 to 6% of the population. Those folks with fibromyalgia, especially because they're not getting proper medical care, are 3 times more likely to be utilizing medical care. With Swing Care's approach to reducing fibromyalgia severity, we have the chance to reduce costs by 30%. Disability is high in our community. It's a high fibromyalgia is a big reason for disability claims, and the average missed work per year for somebody with fibromyalgia is 21 days a year.
Yeah, employers should be paying for your app for sure. Matt, back to you. I'm blown away by these leaders. I love leading this industry.
Oh,
so
well, fantastic. I mean, those are really 8 amazing rising stars. And so, think about all the great things that you're talking between you. We're talking about, we have improved radiology in breast cancer, improved surgery for breast cancer, menopause, fibromyalgia, birth control. Who am I missing here? Hang on, abortion care, and one. I'm blanking on Lydia. Hang on, Lydia, you're sorry, and incontinence, right? All amazing. And congrats, particularly to Joanna, who raised a ton of money this week and probably shouldn't be in the rising stars anymore. We'll get you in the best in class. So that is that. All of the judges, you get to have to pick 3 of the, well, you pick yours, and 3 of these wonderful, wonderful companies will get a Rising Star award in 9 days' time. And that is that for the Rising Stars. We're going to flip over to the best in class, who are the slightly bigger ones, but you, as Brittany says, you're all stars. Fantastic. So cameras off for you all, please, and cameras on for the 4 best in class. And we will do this. We will do it again. Okay, fantastic. So same thing. We're going to do it this way around. We're going to start with a quick sort of 30 to 45 second elevator pitch about what you all do. And then it'll go over to Brittany, and she will lead you through a longer Q&A. So we have about 20 odd minutes for this section. First things first, though, let's start off with PeriGen. Unmute, please.
Hi, greetings, everyone. I know it says Matthew Sappern. He sent a note. He's actually on a plane flying through a storm. His flight got delayed. So he asked me he didn't want to miss the opportunity to address the group. So he congratulates everyone for pursuing such important missions. And he knows the entirety of Team PeriGen appreciates being considered in such great company. So my name is Lexi Maxwell. I am on the marketing team here at PeriGen. We're very passionate about protecting moms and babies during childbirth. We offer innovative perinatal software solutions that are based on FDA-cleared artificial intelligence. We're based in Cary, North Carolina, in more than 500 facilities across North America. Our maternal fetal early warning system, Vigilance, it automates the process of identifying patients who may be at risk for adverse outcomes during labor and delivery. And it's the only AI-based EFM analysis tool that's commercially available in the US. So our vision here at PeriGen is to be the most impactful technology company, helping the world to eliminate avoidable bad outcomes in childbirth and the emotional and financial tolls of these events. So
brilliant. Thanks,
happy
Lexi.
to be here.
Thanks for pinch hitting. Always, this stuff always happens in a crisis. So brilliant. All right, next up, Leon from MobileODT.
Oh, thank you. Thanks for having me. So my name is Leon. I'm the CEO of MobileODT. Every 2 minutes, a woman dies of cervical cancer somewhere around the world, and that is a horrendous number. And it's generally found in the low and mid-resource settings. These women are dying, and there's the two main reasons why these women are dying. One is poor accessibility to health, and the other is loss to follow-up. And MobileODT has developed a program, what we call a single visit program, which overcomes both these issues. And we believe that we can solve the cervical cancer problem in the mid and low resource settings for over 85% of the women. We've developed an HPV antigen test, which will give you a result within 10 minutes. We've developed a digital colposcope, which has artificial intelligence on. So it allows us to put the colposcope in the hands of nurses and non-specialists, which are very rare to find a colposcopist in some of these developing countries. And we've developed a thermocoagulation technology, which solves the precancerous lesions and solves it within 45 minutes. So at the end of the day, we've solved the main problem of the real reason why women are dying at such an alarming rate. The poor accessibility and loss to follow-up we've solved this problem with our single visit program.
Fantastic. And Leon, I had Ariel Beery from back in the day at Health 2.0 a number of times with always an amazing thing. It's so great to hear all the developments and the product developments and the progress you made since then. Wonderful. All right. Next up is I think it's Jill. Unmute Jill. Jill from Volpara.
Thank you. Sorry, rookie move. I am Jill Spear. I'm here from Volpara Health. And breast cancer affects a staggering amount of women. It's a real population health problem. About 1 in 8 women in the United States will develop breast cancer in their lifetime. And when anyone in the family gets cancer, the entire family is affected. And that's our vision and our mission at Volpara, is to save families from cancer. One way that we do this is by challenging the status quo around personalizing breast cancer. A lot of people think of this as an old person's disease, and that average risk, what we do today in personalizing a screening pathway, is good enough. What we do at Volpara is we allow any provider to do a comprehensive risk assessment of each patient and their patient encounter without leaving the electronic health record. So we use multiple models. We focus on different risk factors to make sure that no one falls through the cracks. And different risk models can predict and refer patients to different interventions and different screening pathways that make a huge impact on these women finding stage 0 and stage 1 breast cancers instead of stage 4, which ultimately affects their survivorship, and that they can have very low intervention and treatment for breast cancer. We go beyond this too, and we do endometrial, colorectal, pancreatic, and ovarian cancer all within that same workflow. So we can really look at the whole well woman and guide her in the right way.
That is fantastic. And, again, and finally, we're going to move to Hilary from Fertility. And I'm pretty amazed because we've gone through 12 women health companies. This is the first one to talk about fertility, which basically was the sector a few years ago. So Hilary, take it away.
Thank you, Matthew and Brittany. Really happy to be here. I'm SVP of Strategy here at Carrot and just honored to be here on behalf of the company. Carrot Fertility is a leading global fertility care platform. We work with more than 850 customers today around the world, covering more than 2 million lives, and we're available in over 130 countries today, with members, as I mentioned, around the world. We focus on lifelong fertility healthcare, and for us, this means not only egg freezing, IVF, and IUI, but also preconception, pregnancy, postpartum, return to work, and most recently, menopause and low testosterone support. As part of an equitable fertility offering, we also include coverage for adoption and gestational carrier services. Our approach is unique for being highly personalized and flexible. We firmly believe that no fertility and family journey is the same, and that is becoming increasingly true over time. Our customers use Carrot to customize a fertility benefit that provides employees with financial, medical, and emotional support while also delivering improved clinical outcomes. Our approach to coverage is unique in that it enables employers to provide fertility benefits with greater flexibility and transparency, and also with more predictable cost controls. In our world, the employer's nightmare is a multiple birth with a prolonged NICU stay, and our single embryo transfer protocol is unique in the market and industry leading in helping employers reduce those downstream negative events.
So awesome, everybody. As someone who's been in healthcare for a long time, I think that a lot of healthcare innovation are these incremental improvements. And one of the reasons I love women's health innovation is because these solutions you're creating are leapfrogging us dramatic leaps forward in terms of how procedures are done, diseases are treated, etc. And so I would love for you to tell our audience, what did physicians or patients do or use before your solution existed? And now that they have yours, what are they able to do with it? Tell us about how big of a leapfrog your solution was able to provide to the market. And I'm going to kickstart it off with PeriGen.
Yeah, thank you. Yeah, I mean, our early warning system, when I joined the company 5 years ago, the basis of electronic fetal monitoring was just surveillance, and you're counting on the nurse to make an assessment, and it's very subjective. And now with the nursing shortage and, sicker and older moms coming into the hospital, it's more important than ever to have an early warning system that if that nurse is in another room taking care of another patient, that that you're being watched 24/7, so that nurse can be notified that, hey, you need to come back in this room and care for this patient. And like I said, people are having babies older than they were previously. There's a lot more comorbidities, and it's just more important than ever to have this objective assessment and not left up to a subjective nurse force that really is strained right now. So.
Incredible. Leon with MobileODT.
Yeah, so in many cases, because we work a lot in the developing world, in many cases there wasn't anything there, or there were untrained nurses making a decision. So when we developed our artificial intelligence allows the nurse to make a decision as good as a colposcopist. So this is a huge jump forward. It takes them about 60 seconds to get that decision. And then with our thermocoagulation at point of care, they can treat. As I said to you earlier on, the biggest problem was lost to follow-up. In the developing world, a woman can go to a screening camp and she can drive for 40 kilometers and spend the whole day waiting in line just for a pap smear. And then 4 or 5 weeks later, they call her back. 60 to 70% of the women are not coming back because they're breadwinners and they cannot spend another day waiting in line. So we put together this program that in 45 minutes, we can solve the cervical cancer burden for 80% of the women. So this is where we are today.
I love it. You didn't improve tech with a little bit more tech. You are literally improving human subjectivities and opinions with technology. I love it. Jill.
Thanks. So breast cancer is really on the rise for women under 40. And all of the 4 largest society groups that recommend women for screening for breast cancer are the American College of Radiology, OBGYN, the Society of OBGYN, the Society of Breast Surgeons, and the National Cancer Consortium Network. All of them recommend that you know your genetic risk by the age of 25. So at the end, I'll ask you, Brittany, do you know your risk, your genetic risk of breast cancer? And so what are we dealing with, and what is the societal impact that we have? Is I would argue that probably everyone watching this video does not know their risk at this time, when all of our 4 largest industry groups are making that very formal and visible recommendation to us. So we're really trying to cut through the litter, the barriers that you see around what is the screening age, what is my screening protocol, what is the personalized screening pathway that I should take, and making sure that every woman is aware of her risk and doing that right, because we can save lives. I saw a great talk last night in California mapping out the population of women that if we understood their genetic risk every year and personalize their screening pathway, 2,100 women in California every year would be impacted with a stage 1 diagnosis instead of stage 4. So think about that, saving that many lives in that state annually. So while the debate about what is the best practice for routine screening, we're delivering that to every woman in their care pathway and making a real difference in saving lives.
Absolutely beautiful. And Hilary, a little bit of fintech and our femtech here. What did we do before Carrot?
Yeah, so the world before Carrot and the world before fertility coverage existed meant that many families and patients simply could not afford fertility treatments. Fertility has historically been a cash pay market, and as many of you may know, treatments cost many tens of thousands of dollars, just putting them far beyond reach for most Americans. And of course, our members are around the world, so for those outside of the US as well. Then first generation companies came into the fertility space. That also includes sort of infertility riders through health insurance. And those solutions really fast-tracked all patients to IVF. It was sort of a very blunt, kind of one-size-fits-all approach to receiving this kind of care. With Carrot's solution, we believe that while IVF can be necessary for some patients and of course life-changing, it's also very expensive and emotionally draining and potentially unnecessary. So our approach is first to educate members about their options and then guide them to a particular intervention that actually meets their needs and is appropriate for them based on their goals. So that might be IVF, but it might also be sort of more holistic kind of lifestyle interventions as kind of a first line approach. Things like nutrition as sort of a way to improve insulin resistance, to lower BMI, which is very much associated with PCOS, which is a sort of underlying cause of infertility for many people. So there are these sort of less invasive options that are available to members, and we really think it's part of our job to make sure they're aware that those options are available to them and to steer them to the right provider who can help them meet their family forming needs and potentially also avoid, many tens of thousands of dollars in expensive healthcare claims. The other point I just want to make around fertility support and sort of the importance of it in society more broadly is that supporting women and families across the life cycle of fertility health is important, not just for healthcare, but also for equity in the workplace. The sort of financial and emotional costs of fertility treatments fall disproportionately on same-sex couples, and of course, women bear the brunt of pregnancy and delivery sort of costs. I recently returned to work from maternity leave and felt ready to do so in part because of postpartum support that I received through Carrot. And I have many colleagues, both at Carrot and friends who, view family forming goals sort of much more flexibly than they ever were able to before, because this access to this kind of care is becoming more mainstream.
Excellent. Well, I've been given permission for a fireside secondary question. I want to know what is next for your company. What should we be looking forward to? I'm really excited about the women's health industry. It's predominantly seed stage, very early, but you guys are some of our best in class. You're down the road. You're doing it. You're in the market. You're changing lives. What can we expect next from you? And I might be putting PeriGen on the dot because I don't know if you know this answer, but tell us what's next for PeriGen. What can we expect?
Yeah, it's probably a better answer coming from our CEO, Matt, but I'll take a stab at it. So we're really moving into the risk management space. Our latest product, Labor Watch, is an escalation tool. So we found, especially with these stretched hospital and labor and delivery floors, sometimes there's a lot of bad outcomes that relate back to failure to escalate, right? Not taking this up the chain of command that something might be wrong with this mom and baby. So our latest tool is automated escalations, right? That nurse is busy trying to do the interventions, but after this mom, you know, our artificial intelligence has interpreted the strip and sees that for 60 minutes, something isn't right. It's going to notify the next person in the chain of command all the way up to, you know, whoever they designate as the top. And I think this is huge because they're getting everyone involved, and it's not just the nurses in that room who know that something's wrong. Now the rest of the hospital knows, hey, we all need, you know, all hands on deck to take care of this mom and baby.
Advancing your tech, spreading out the responsibility. I love it. Leon, what's next for MobileODT?
So we've got a lot of experience in selling technology, but one of the things that we found early on is that it's not good enough just to sell the machines. We need to implement the technology into the market. So we're now embarking on a very, very ambitious program in the Democratic Republic of Congo. We are now going to establish 1,000 women's health clinics in the DRC. And that is going to be a huge milestone, because there we'll put our technology. Not only are we looking at cervical cancer, we're looking at breast cancer, because when you put cervical cancer and breast cancer together, that is more than 51% of all cancers of women. And we believe that this will bring some equality to women's health. There's only 2 men on the panel, but I firmly believe that we need to enhance women's health, especially in the developing world. So opening up these 1,000 clinics will give a huge boost to women, and hopefully will make a major impact on cervical cancer on the continent.
I anticipate some more social impact awards coming your way, Leon. That's beautiful, amazing. Jill, what's next?
So what's next is short-term and long-term. Short-term, there's 13 different genetic mutations that can lead to breast cancer and tying you into all these other things. So we have to keep on top of all the research and really the rapid acceleration of what we know about your genome and how it impacts your health. We're adding more models, and we're also integrating your tissue texture, your breast tissue, and what that tells us into this. It's another strength of Volpara that we can do a pixels and integration and understanding of your tissue density and leverage that into your mapping. Over the longer term, we want to pull the women into understanding their own breast health and advocating for themselves. It's fun to see people like Katie Couric and Joan London and people really wanting to share their story, but we all have our own story, and that's our personal care plan that we go on in our own health journey. So we want to be engaging the women to do a better job of really personalizing and taking those actions that they can do to diagnose cancers earlier and help their families.
Well, my dog is very excited about all these innovations, so he's joined us. Hilary, what's next for Carrot? You guys have been around a while. What can we expect?
Yeah, so we've been on the market and serving members now for, I think, over 8 years now. And what's really exciting about that is we have developed a series of really millions at this point data points that relate to members' experiences going through various fertility treatments and interventions. And so we've talked a lot about sort of the personalization aspect of our product, and we're looking forward to sort of ratcheting that up a notch and moving towards a model that looks a little bit more like precision care. And again, like that will be informed by sort of the years of data that we have collected over time, and with the goal of really sort of delivering very precise care to members based on their specific medical needs and backgrounds and knowledge that we have about where particular providers in the market have been able to drive superior clinical outcomes for members who look just like the member going through their journey today. The other area that I would point out, we recently launched menopause and low testosterone support. We believe firmly at Carrot that fertility can be sort of the front door for many women and families, at the sort of front door to the healthcare system. And so we're looking forward to potential launches in other sort of adjacent areas. We talk sometimes about teenagers and sexual health and hormonal health for younger populations. We talk sometimes about cardiometabolic conditions, because there are some sort of synergies there. So we really are building the sort of lifelong fertility care platform, and we mean that in the broadest sense possible.
We need data to move women's health forward, so I'm so excited to see what you guys publish about that. Matt, I think we need
brilliant. it's such a great idea. Let's do a group selfie. Anybody who's left from the Rising Stars, please switch your camera back on. I'll grab us a big group. Anybody else left? We haven't got everybody. A few.
No, it's everybody turn your
Cool.
cameras on.
Turn your cameras on if you can, and I'll grab a group selfie while we are.
Brittany,
Anybody else going? Yeah. Oh, okay, ready, steady, and.
Oh, Brittany, your camera's off.
No, I've got her. Don't worry.
Oh, it's weird. I don't see it.
Fantastic. No worries. So that is it. So you have just heard from the you've just heard from the best in class. So judges will get to vote on the one out of those four. 3 out of the Rising Stars will get chosen. So please, judges, go and look them all up. I know there was one. I'm blanking on the one who was not here.
Fertility.
Yeah, Fertility. That's right. Fertility. Fertility was not here, but please go look them up as well. To everybody else, we will see you all on Monday night. You'll see Brittany will be handing out the awards, and I will be waving and stuff. So looking forward to seeing everybody. What a fantastic set of companies, and really great. Thanks for entering the awards. Congratulations on getting to the finals, and we'll see the results on Monday live at Health.
Great. Thanks so much, everyone. Look forward to meeting you all.
Hi, my name is Leon Boston, and I'm the CEO of MobileODT. Our mission at MobileODT is to make an impact on women's health. We're starting with the leading reason for women's mortality worldwide, which is cervical cancer. Every 2 minutes, a woman dies of cervical cancer around the world. And there are 2 main reasons why there's such a high mortality. 1, poor accessibility to healthcare, and 2, loss to follow-up. But MobileODT has developed a program which overcomes these 2 main challenges. We have created a program which is a single visit screen and treat program, which can treat a patient screen and treat a patient within 45 minutes. This program is suitable for more than 85% of all women worldwide. Our Delphi HPV antigen rapid test will give a result in 10 minutes. There's no need for a lab. Having a rapid antigen test with immediate results at point of care can eliminate loss to follow-up. This is a significant step forward in our fight against cervical cancer. When we couple the HPV rapid test with our digital colposcope, which is powered by artificial intelligence, our artificial intelligence allows non-specialists to be proficient in their diagnosis and treatment. In our case, it has had a great significance because it overcomes the main issue of accessibility to healthcare. On finding a positive patient, our Thermoglide can treat at point of care all patients with precancerous lesions. A precancerous lesion which is not treated will lead to a high-grade cancer. Our screen and treat program is unique. It is a combination of 3 innovative technologies, and this allows us to screen and treat women at an unprecedented scale. Our program is already implemented in many national screening projects around the world, in Africa, in India, and other countries, saving women's lives, making an impact on women's lives. I believe that MobileODT has developed a smart but yet simple solution for one of the major problems of women's healthcare world.
Volpara is on a mission to save families from cancer. Cancer cases are rising each year, and 1 in 8 women will be diagnosed with breast cancer during their lifetime. As a certified B Corp, Volpara's vision is simple: to be the global leader in software for the early detection and prevention of cancer, and we are well on our way. Healthcare providers and imaging centers use Volpara software to better understand cancer risk, to empower patients in personal care decisions, and to guide recommendations about additional imaging, genetic testing, and steps for cancer prevention. Volpara also provides the world's only AI-powered objective volumetric parameter, Volpara, density assessment algorithm that helps radiologists quantify breast tissue with precision, and it's integrated into the popular Tyrer-Cuzick 8 breast cancer risk model. Volpara's AI image analysis helps technologists produce mammograms with optimum image quality, best positioning, ideal compression, and the precise dosage necessary for the best chance of early detection of breast cancer. Our entire focus is to give patients the best opportunity for prevention or early detection of cancer. And what is our superpower? Our superpower is performing tasks for clinicians that humans either cannot do or can't do in a reliable, reproducible, and fast way. We take the subjectivity out of clinical assessment and we provide quantitative, objective data to inform essential decision-making around patient care. Our software assesses mammogram quality with AI based on key positioning data. It precisely quantifies the amount of breast density in each breast to assess cancer risk. And it calculates cancer risk with multiple models, providing in-depth analysis and different risk factors without leaving the clinician's electronic health record workflow.
Hi, I am Matthew Sappern of PeriGen Perinatal Systems. I'm the CEO here. And I want to thank you very much for allowing us to be part of the consideration to win the Digital Health Award in Women's Health. I want to tell you a little bit about our superpower. We protect moms and babies during childbirth. You know, more than half the bad outcomes in childbirth are avoidable, often rooting back to subjectivity in assessing fetal strips and how the labor is progressing. PeriGen helps ensure consistent assessments of how mom and baby are tolerating labor. Objective data, objective assessments, not subjective opinions of any given nurse at any given time. And health systems that are using our solution are actually finding double-digit reductions in the leading indicators of bad outcomes, like concerning fetal heart tones or uterine tachysystole. Less preventable bad outcomes equals fewer children requiring expensive lifetime care, less emotional and reputational distress for both the family as well as the caregivers, and ultimately less medical malpractice exposure, which has become excessively expensive for health systems these days. Our solution essentially uses artificial intelligence to continuously monitor and assess clinical trends in labor, taken from bedside monitors and from a few discrete data points in the EMR. We consistently identify abnormalities in fetal heart rates or maternal vitals, and we suggest opportunities for intervention, either at the bedside or in a centralized hub deployment. We think our company should win because our solution is proven, it's accessible, it's scalable, it's backed by proven outcomes, and most importantly, protects moms and babies at their most vulnerable time.
Is IVF the only option?
Is menopause care covered?
Do I need a lawyer for adoption? Where can I go for support?
That's a great question. Let me help you find out what's possible.
Carrot provides inclusive, global, lifelong fertility and family-forming support for people of every age, race, income, sex, sexual orientation, gender, marital status, and geography. We're localized, personalized, and culturally competent. It's time fertility care included everyone, so you can pursue your possible.
My name is Yael Kfir.
and I'm the Chief Strategy Officer at Fertility. Our solution is really around transforming reproductive care into a transparent process that delivers unparalleled visibility to the reproductive and IVF professionals as well as patients. Our core technology at Fertility is called Chloe, which is a single intelligent product with an expanding set of capabilities for reproductive care, which spans from fertility preservation through egg donation as well as IVF. Our Chloe technology streamlines oocyte as well as embryo quality assessment with automated AI-driven analysis. We offer differentiated solutions by being the first and only transparent artificial intelligence tools that provides a quality scores, which is also accompanied by biological data of the quality of the eggs and embryos. So in other words, we provide information in biological terms, and this is the language that clinicians can understand and trust. Chloe is designed to improve the outcomes for fertility care professionals and patients by supporting more personalized, effective, and patient-centric decision-making, and by improving the overall efficacy of reproductive care. So what's our superpower? Well, we support the creation of life. I mean, what greater power is there? We help prospective parents achieve their goal of pregnancy. We support the decision-making for fertility preservation, egg donation, as well as female factor infertility and IVF. Why do we think our company should win? Well, one of the biggest issues of the WHO, the World Health Organization, is the aging population and the decline in birth. And by bringing the latest in innovative technology, machine learning and AI into this field, together with the clinicians, we can change the entire reproductive care process. We can bring down cost, we can improve efficiencies, and altogether support the most critical process for the continuation of humankind, which is new life.
I'm Mike Rosenbluth. I'm CEO and founder of Swing. Swing is changing the way we treat chronic pain conditions, starting with fibromyalgia. Fibromyalgia is a chronic pain condition that affects 4% of the US population, over 80% of whom are women. It's the second largest rheumatologic condition, affecting 6 times more people than rheumatoid arthritis. But fibromyalgia has been stigmatized in the healthcare system, with many patients being dismissed or told that it's all in their heads. When they are treated, they're usually given a drug and told to come back in 3 to 6 months while they struggle with their symptoms. Swing is bringing patient-centric care and evidence-based treatment to this chronically underserved population. We developed Swing Care, the first virtual care platform specifically for comprehensive fibro treatment. We also built Stanza, a novel digital therapeutic that delivers acceptance and commitment therapy, a guideline-directed treatment for fibro through a 12-week self-guided program. The FDA-designated Stanza is a breakthrough device and granted Stanza de novo marketing authorization this past May as the first prescription digital therapeutic for treating fibro symptoms. By combining virtual care and novel digital therapies, we can provide patient-centric care that treats the whole person, no matter where they live. We've seen amazing results from this approach, with over 80% of patients reporting clinical improvement after 3 months. Our superpower is building evidence and translating that into personalized, accessible patient care. We believe that in order to change the standard of care in medicine, digital health companies need to lead with evidence. We're committed to doing so and have been more successful at this than any company in the field. We've run 7 prospective clinical studies, including 2 randomized controlled studies, 3 long-term durability studies, and 1 real-world evidence study to demonstrate the value of our intervention, including the biggest device trial ever undertaken for fibro treatment. If you think of fibro only as a biological problem, you'll only use drugs to treat it. But fibro has neurologic and biopsychosocial components, which is why current treatments are so ineffective. We've taken a comprehensive approach to care that is truly multimodal and that can treat the whole patient. We need new approaches to chronic pain conditions that are safe, have robust clinical data, and can meet patients where they are. That's what we're doing here at Swing.
My name is Ananth Ravi. I'm the CEO and co-founder of MOLLI Surgical, a medical device company whose aim is to dramatically improve the patient experience of breast cancer. We exist to save and improve lives through cutting-edge technology. We do this by implanting a tiny permanent magnet, the smallest one available on the market. And this is done by a radiologist in the clinic. And then a surgeon uses a wand and a tablet to pinpoint the location of that marker and remove it with unprecedented accuracy. We recently released the groundbreaking MOLLI 2, which builds on our award-winning platform. It not only offers the surgeon a distance between the tip of the wand to the marker, but also provides them directional feedback. Our superpower is we are obsessed with the patient experience. We obsess over the size of the marker that we use to implant to mark the smallest of lesions. We obsess over the sharpness of our needles to ensure that it is as easy as possible for a radiologist to insert. We're passionate about developing technology that improves women's health by addressing important clinical health challenges. We believe treatment itself is not enough, but the experience of the treatment is just as important, and we hope to make a significant improvement there. We offer patients and caregivers programs such as HOPE, which stands for Help, Optimism, Positivity, and Empowerment. And that works alongside patients and caregivers to address unanswered questions and facilitate their journey of breast cancer care.
Hi, I'm Elizabeth Ruzzo. I'm the founder and CEO of adyn. At adyn, we have created the first and only test designed to prevent birth control side effects. I started adyn for two main reasons. The first is because this is a problem I've personally experienced. My birth control side effect was suicidal ideation, and my doctor didn't believe me. I didn't want other women to suffer through that experience or needless trial and error the way that I did. The second was that I wanted to use my expertise in precision medicine to make scientific discovery more inclusive by focusing on populations outside of males of European descent. Birth control is famous for providing freedom from unwanted pregnancy, but it's also the most common medicine used to manage female reproductive disorders like endometriosis and PCOS. Unfortunately, the 200 birth control options are also widely known for side effects, ranging from annoyances like acne and weight gain to life-threatening adverse reactions, including depression and blood clot. Our solution is the birth control test. The birth control test creates a new evidence-based standard of care, which not only centers but empowers patients with their own information to truly choose the birth control that is best for their unique biology. The impact of our test has been incredible. 94% of patients switch methods as a result of the birth control test. And medical providers who've used the birth control test say that it informed their decision in 97% of the visits. And perhaps most remarkably, we've already helped 7.5% of our initial population to understand their genetic risk for blood clot and potentially save their lives by helping them switch to a safer option. Our superpower is our science and our lived experience. adyn's precision medicine platform, combined with our scientific vision and decades of research experience, means that we're going to be able to partner with patients from menstruation to menopause. The medically actionable reports we can provide will improve health outcomes for this historically underserved and under-researched population.
Hi, I'm Gabby Santana, the Chief Revenue Officer at Hey Jane, a virtual reproductive and sexual health clinic that always puts patients first. From day one, we've been committed to providing safe, discreet medication abortion treatment, no in-person clinic visit necessary, and have helped more than 30,000 people get the care they need during this pivotal moment. Today, we offer a range of reproductive and sexual healthcare services, including birth control, emergency contraception, and treatment for UTIs, yeast infections, BV, and herpes, all from the comfort and convenience of your phone. We believe in getting our patients not just the care they need, but also the support they deserve. We offer patients the same FDA-approved treatments they'd get from an in-person clinic, and quickly. They can consult with one of our expert providers within one day. Medications are then delivered discreetly to their home, a PO box, or wherever is most convenient. And our in-house clinical care team is always just a text message away. If we had to describe our superpower, it's definitely our patient-centered clinical care team combined with our purpose-built technology that creates a better experience for clinicians and patients alike. Our clinical care team are not only experts in their field, but also incredibly compassionate individuals who want to ensure that every patient is seen, heard, and cared for. It's why our patients put their trust in us and has resulted in our industry-leading NPS score of 92. And as a leader in the health tech space, we value innovation that benefits the patient experience, including technology that helps people feel better faster, easier, and at scale. During this pivotal moment for reproductive and sexual health care, Hey Jane has been a leader in finding solutions, increasing access, and delivering best-in-class care. Thank you.
Hi there, I'm Jill Herzig and I'm the Chief Brand Officer of Midi Health. I'm also a patient, so I feel pretty qualified to tell you about who we are and what we do. Midi is the only virtual platform designed specifically for women in midlife. Our mission is to make expert care for perimenopause and menopause accessible and affordable to women across the country. Here's what we'd like you to know about our solution. We care for women via convenient virtual telehealth visits. We accept insurance for our care and our prescriptions. That's vital for access. All of our clinicians are trained in menopause. The care they give follows guidelines and protocols designed by world-class experts in women's midlife health. We do prescribe hormonal therapies, but we also look to non-hormonal options because some women can't take hormones and others just prefer not to. So, what is Midi's superpower? I think it's that we make every patient feel heard. Active listening helps us connect the dots on whatever they're experiencing so we can pinpoint truly personalized solutions. And why do we think we should win this award? I'll let a patient answer that. She writes, Midi Health has changed my life. Until I started hormone therapy, I didn't realize how badly I was suffering for at least 7 years. Now I'm sleeping like a baby, little to no joint pain, and 0 hot flashes. Moodiness and brain fog have lifted. I'm so much more relaxed and happy. So awards are wonderful, and we hope to win this one. But these comments come in by the hundreds every month at Midi. They're why we built the company, and they're what motivates us every day. Thanks so much.
Analyzing mammography images correctly is the most crucial moment in early detection of the breast cancer. The physician who is responsible for that is the radiologist, who has to read over 800 images per day, relying only on the technology of the naked eye. Radiologists are overwhelmed, overworked, and because of that, at risk of oversights. I'm Lilia Shwartsman. When I founded MICA AI Medical, it was important for me and for my partners to assist radiologists so they could save more lives. We developed an amazing, cutting-edge AI technology platform that 1. Highlights suspicious findings. 2. Detect any changes by comparing images from different years. 3. Provide clear mammogram for women with dense breast tissue. Not many people are aware, but more than 40% of all women have dense breast tissue. For them, mammography testing is unsafe. Reading their mammograms is like driving in extremely heavy fog. From day one of creating this technological solution to a very human problem, we joined forces with Sheba, one of the top 10 hospitals all over the world. This provides us the advantage of collecting enormous amount of unique data, relying on knowledge and experience of the best physicians. This took our algorithms to a whole new level and defined our product market fit. Today, our regulated, validated, and patented technology is an internal part of Sheba's radiologist's daily workflow. We're implementing process in 2 more hospitals, and the results are amazing. Up to 90% 5% increase of accuracy and 35% decrease of unnecessary painful biopsies.
More than half of adult women suffer urinary incontinence. With the most common type, stress urinary incontinence, leaks occur with everyday activities like laughing, coughing, sneezing, or running. As you can imagine, this has a significant negative impact on a woman's quality of life. I'll share just 2 examples. UI is linked to more than double the rate of urinary tract infections, and even more alarmingly, to more than double the rate of severe depression. So we have an issue impacting 1 of 2 women and associated with significant mental and physical health challenges. But historically, women have faced 2 problems. First, UI has been stigmatized and not openly discussed. And second, clinicians have had a lack of effective, convenient treatment options for a woman who does not want to have surgery. And this is where Flight comes in. Flight is a novel FDA-cleared in-home treatment for stress urinary incontinence. Originally developed by a team of researchers, physicians, and engineers at the Arctic University of Norway, Flight is the first and only product to deliver a treatment modality called mechanotherapy to treat incontinence. But what is truly unique about Flight is that we've been proven in 2 substantive clinical trials to deliver continence rates and durability of treatment effect comparable to surgery in the fastest in-home treatment available. And that is a game changer that empowers both women and clinicians. Our focus today at Flight is on payer contracts to enable broad access. Studies show that 70% of costs associated with UI today are borne by women. That's just not acceptable. Every day, our team is motivated by the difference we're making in the lives of women who have returned to continence because of Flight. And we're honored to be playing a role in ensuring that all women have access to clinically proven, effective, high-value, convenient care.